we'll move swiftly straight into the talk. So our first speaker is Thuo. She is a retinoblastoma cancer survivor. And I think I first met her, I don't know if she still remembers me, but I first interacted with her in a street cleanup all the way in Kasarani. It was organized by Malaika Shujaa Foundation, and I was really touched by her strength and her motivation and her passion that day. And I'm really excited to be with her in this talk. So she is the founder of Malaika Shujaa Foundation. This foundation specifically works to raise awareness in pediatric cancers. I'm sure most of you are aware that these days cancer is not for the old, and cancer is not for the rich who are old. It affects all ages. It affects all people of all economic statuses. So it will be wonderful for her to give us an insight on how she has worked in the pediatric cancers. And our second speaker will be Mr. Anthony Muchiri. He is a medical oncology clinician, and he's currently working with the International Cancer Institute Care and Research Clinic. He is part of an amazing team that screens, diagnoses, stages, and treats cancer patients. He's also involved in other type of referrals that are related to cancer and all other forms that cancer is treated. He is passionate about cancer and patient care and has a wealth of experience in so many institutes and so many hospitals in Kenya. And he's also involved in a number of clinical research and clinical trials that are geared towards finding the cure for cancer. So moving quickly, we'll invite our first speaker, Thuo, to tell us more about pediatric cancer and her journey throughout the whole process and what she has learned during her time working with people and working around children with pediatric cancer. Welcome, Grace.
Thank you so much, Michele. So my name is Thuo. I am a retinoblastoma cancer survivor, like Michele has spoken. We met at one of our events here at Kasarani, and I'm so glad to actually be on this platform. So thank you once again. Thank you so much, Michele. Briefly to just highlight on my story, I am a childhood cancer survivor, and this is actually not my real eye. This here is a fitting. It is a prosthetic fitting, whereby my real eye was amputated. My real eye was amputated at 9 months. At 9 months. So from there, I didn't do so much treatment. I only underwent 2 surgeries, and that was enough to declare me cancer-free because my retinoblastoma was actually at the first stages. So, well, that is my journey with cancer, and I thank God for the fact that He has brought me. So, briefly, to just talk about what we do. Malaika Shujaa is a foundation that creates awareness on childhood cancer. Simply because I survived it as a child, so I thought upon myself that we should create much awareness about childhood cancer. So we are supported by the National Cancer Institute of Kenya. We are also supported by the Kenya Network of Cancer Organizations, KENCO. We are also supported by the National Non-Communicable Disease Alliance of Kenya. So, yeah, that is all. That is just a brief about Malaika Shujaa. So just straight on to what is childhood cancer. Most people don't imagine that a child can actually get cancer, which is true. Children are also diagnosed with cancer. In fact, 10, in fact, what are the statistics? You find that 10 children, they are being diagnosed with childhood cancer here in our country, which this is not the exact figure because we lack a standard registry, but we have a lot of cases being recorded in our country. So that is just a brief. Well, I will just go straight on to highlight a few topics here and there of childhood cancer. So first and foremost, childhood cancer often occurs in the stem cells, which are simple cells capable of producing other types of specialized cells. So when there is a sporadic change in these cells, or when there is a mutation in these cells that is uncommon, this is where it births the cancerous cells. So what is childhood cancer? These are abnormal cells that are growing in the body of a child. That is what childhood cancer is. And somebody may ask me, Mwalimu, because I am a teacher, what are the types of childhood cancer? There are actually several. We have leukemia, which is the most common actually in our country right now. This is the cancer of the bone marrow or the cancer of the blood cells. Leukemia. We also have brain tumors. These are tumors that grow in the brain of a child. We have neuroblastoma. These are cancerous cells that are usually formed by immature nerve cells. We have Wilms tumor. This is actually the most common type of kidney cancer that is found in children. We also have lymphoma. Let me repeat that. It starts in the cells of immune system called lymphocytes. So this is lymphoma. So basically, those are the major childhood cancers here in our country. We have general organ cancers. When I talk about organ cancer, I talk of leg cancer, hand cancer. So organ cancer, we can just mention the organ, the name cancer over there. So to just generalize, if you suspect that your child has cancer, what are the symptoms to begin or to observe basically in the body of a child? There are several signs and symptoms that are actually observable in a child that may, I repeat again, that may indicate that this child has cancer. For example, an unusual lumping or swelling in a specific part of a body. You find that there is an unusual hard lumping, maybe in a child's hand. So you can detect that early enough and go to be confirmed whether it is cancer or not. We have unexplained paleness. Some kids, you find that they will be pale and lack of energy. They may show fatigueness. That is one. We also have an ongoing pain in an area of our body. For example, if it's a leg cancer of a child, there may be an ongoing pain, and the child is complaining so much about a certain pain in a certain area. We also have a symptom like unexplained fever. This is fever that has no origin. It is just recurrent. When you go to the hospital, you have no clear diagnosis whether it's malaria or what. It's just a fever that has no origin of its own and it's recurrent. We also have sudden eye vision changes. You may experience that the vision may change in the child. There is also frequent headaches, often accompanied with vomiting, especially to children. This is common. Frequent headaches, often accompanied with vomiting. So I have highlighted in general some of the signs and symptoms that may indicate, not actually totally indicate, but may indicate childhood cancer in our body. So up to there, I think we have an update.
Grace, you're breaking up a lot. Could you sit in a position that you have better internet connection?
Okay, yes, I can.
Okay,
Am I breaking?
Please do. You're breaking up quite a bit.
How about now?
Yes, it's a bit clear. Thank you.
Okay, thank you. So up to there, I hope even with my small breaking here and there, you have gathered something. So if anyone may ask you, what are the types of childhood cancer in Kenya? We have leukemia, we have Wilms tumor, there is retinoblastoma, the one that I had in my eye. We have organ cancer. We have neuroblastoma. We have lymphoma. So basically, those are the most common types of childhood cancer that I have mentioned. Then I was explaining a while ago possible signs and symptoms that may indicate childhood cancer. So to go back again quickly, an unusual lumping or swelling. We have unexplained paleness or loss of energy or fatigue. We also have an ongoing pain in a certain part of the body, unexplained fever or recurrent fever, sudden eye change or visual change. So up to there, I think maybe the moderator can ask a question or two. So back to you, Michele.
Okay, thank you for the information so far. Could you mute a bit as I speak? Okay, thank you. Thank you for the information so far, the basics that you've given us. I don't think I have any question as per now, but anyone in the, any of the attendants or the participants, if you have any question, feel free to type it into the chat box or inbox me directly, and I'll be sure to ask it. If any other question progresses, please feel free to type it in, or after the speaker has spoken, you can ask it. Please continue, Grace.
Thank you so much, Michele. So I'll continue on. We have a lot of parents wonder, if I have suspected that my child has cancer, what step should I take? What diagnosis procedure should I take? Or what factors should I consider when approaching a hospital to be properly diagnosed that my child has cancer or not? Some factors may include the type of cancer maybe you are suspecting. It may have a type of diagnostic test. The child's signs and symptoms may also indicate which type of diagnostic test, that the child may take. Your child's general health may also matter when taking that child to the hospital. And then if there were other results of earlier medical tests, it may also matter. So thank God for the government. It has increased actually the type of tests for childhood cancer in our country. We have routine blood tests. This is usually common in children, especially those that have been diagnosed of leukemia. The routine blood test measures the number of different types of cells in a child's blood level. So this one, they can help us see whether some types of cells are high or some are too low. We also have the most common one actually in our country, a biopsy. A biopsy, this is the removal of a small amount of tissue for examination under a microscope. This is a biopsy. Then recently we have a latest technology to detect childhood cancer, which is non-invasive and it's safe. It's called a liquid biopsy. A liquid biopsy is a blood test for cancer. A liquid biopsy is a blood test for cancer that uses the next generation sequencing of genes to determine whether the child has cancer. We also have bone marrow biopsy, and the common ones that we know, MRI, magnetic resonance imaging. We also have PT scans, and some CT scans. So those are safe for our children to actually be used on them. Some may ask, my child has cancer. What are the treatment options? Because a lot of parents fear chemotherapy and radiotherapy. For children with cancer, this is what we emphasize. There is a treatment called immunotherapy that boosts the immune system of the child while undergoing chemotherapy or radiotherapy. So chemotherapy, these are drugs that are used to kill the cancer cells in the body. Radiotherapy, these are electronic beams of rays used to kill the cancer cells in a child. So childhood cancer is 80% curable. And the good news is that the immune system of children is usually high. So when these treatment options are accompanied by good diet and nutrition, trust me, your child's chances of survival may increase. So we have the common types of treatment: chemotherapy, radiotherapy, targeted therapy, immunotherapy. And all these treatments can also be successful when accompanied by good diet and nutrition. Again, I always say, healing starts in the mind. And a lot of these childhood cancer children, you find they are faced with depression and they are stigmatized. So it is up to us, society, to fellow children, to tell these children they can make it and they will make it. That is where we start the healing process of childhood cancer. So I will invite Dr. Anthony. He will share on a few risk factors of childhood cancer. And as I conclude, let me talk about the COVID pandemic on the childhood cancer burden. You find that recently there was statistics that I read that a few children that have succumbed to cancer during this period had COVID-19. This is because their immune system was weakened by cancer. So when they had the COVID-19, it put them down. So let me discuss a few issues on the COVID-19 pandemic and the childhood cancer burden. A lot of children have lacked access to hospitals because of this pandemic. A lot of children have lacked their anti-cancer treatment because of this pandemic. And there has also been a delay of testing childhood cancer during this pandemic. So this is what I would recommend for any doctor, for any member of parliament that is maybe here, for a multidisciplinary action for children with cancer, that their medication, they may have their medication even while at home. So, and then we are also advocating for caregivers of children with cancer to take 10 times precautions of the COVID-19 so that the children may not be infected. Otherwise, this pandemic, it is wise to watch what your child is eating. The diet of a child may actually contribute to them having cancer. For example, obesity. Obesity may be a risk factor to a child acquiring cancer. We may have the environment. Is your child exposed to bad radiation? Is your child exposed to harmful chemicals? These are some of the risk factors that may expose our children. In conclusion, as I conclude, let us be watchful of our children. I always say again and again, we are what we eat, and our diet contributes a lot. So have a lot of time to prepare natural foods for our children and ourselves. And when I talk about children, I include teens and young youth in this category, because we have had cases of small girls having breast cancer, small girls having cervical cancer. So encouraging a healthy lifestyle for children and teens, encouraging healthy foods, encouraging healthy environments for children, avoid exposure of radiation, avoid exposure to harmful chemicals, and watch on your diet. Avoid excessive protein. They are not good. They are actually useful to the body of a child, but not in excess, because everything in excess is actually harmful. And let us spread the message outside there. This is September. This is the month for childhood cancer. That childhood cancer is curable if detected early. I survived it, and I thank God. So all children battling cancer, they will survive it. Childhood cancer is preventable, is treatable when detected early. Thank you so much. And I think the rest I will leave on to Dr. Anthony to take it from there. That was my time. Thuo, founder, Malaika, Shujaa. Thank you so much, Michele. Take over.
Okay. Thank you so much, Grace. Don't forget to mute. Okay, so thank you for the information you have given us. There's one question that has been sent that maybe you could answer as Dr. is preparing to come in next. What are the chances that the childhood cancer will come back after chemotherapy and radiotherapy has been administered to the child? And if the child is already undergoing has already undergone these treatments, what signs would you advise upcoming parents or uncles or aunties to look out for when handling these children who have already survived cancer? Let me just repeat the question. What are the chances that the cancer will come back after chemotherapy and radiotherapy? And what symptoms should we constantly be aware of to at least know if it's almost coming, so that it does not progress to something more complex?
Okay, thank you so much. Thank you so much for that question. Let me respond to the first question. Children actually respond very well to treatment. So chances that secondary.
We can't hear you well.
How about now?
Please speak up again.
Let me respond to the first question. What are the chances that this cancer may come back, children, after treatment? That was the first question, right?
Yes.
So chances are actually minimal. Children respond very well. Children actually respond very well to this treatment. So for it to reoccur again, chances are minimal, so there is no cause of panic or fear. maybe whether it will come back or not. Then going back to the second question, what are the signs, some general signs and symptoms to observe for children that have survived cancer for it not to come back again? Fever. A recurrent fever is usually a common indicator that I personally have witnessed with children with cancer. General body weight loss, fatigue, and headache. Those are majorly some of the signs that I personally have encountered with children with cancer. But fever, majorly a recurrent fever that has no origin, and body weight loss. Those are some of the beautiful things and symptoms that may be indicator that something needs to be checked somewhere. Have I answered, I think, any other question? Or any clarification that may be
needed? You've answered both questions. I think there's quite a number of the audience didn't hear your answer. Most participants didn't hear your answer so clearly. So maybe we could move to the next speaker. Then after he's done, we could go through the question once more. Is it okay?
Okay, no problem.
Oh, you're even better right now. But we'll answer now after Daktari has gone through his part.
Okay, no problem.
Okay. Moving swiftly, I'd like to welcome Dr. Anthony Muchiri. I already gave a brief description about him, but I'll just echo one part of his bio. He is passionate about cancer patient care and has a wealth of experience in several institutions and hospitals across Kenya. Currently, he is interested in clinical research and trials that are around cancer. So, Daktari, welcome. Please take the floor.
So, thank you so much, Michele, for the introduction. As you have heard, those are my introductions and my bio on where I work. So I'm an oncology clinician working with the International Cancer Institute, and I'm happy to be joining you today. So I'll start by maybe adding one or two things on the last question that was asked about childhood cancers, whether they have a chance of recurring after radio and chemotherapy. And despite the advances made in detecting childhood cancers early and treatments, in the Western world, they're finding that there's the great cure rates occurring between 80 and 95% of the patients. However, we have to always remember that there's a risk of relapse in these patients. So there's need for very keen follow-ups. And regarding how the relatives should treat the children later, I would caution and say that they should be treated like any other kids, only just to adhere to the strict routine clinics. However, there's always that chance for relapse. But like we said, there are those lucky victors who we are, like Grace, we are celebrating today, who have emerged victorious. And for that matter, I think we can wrap up that session about that question. So I'll go next to my presentation. Unfortunately, I didn't base mine on pediatric cancers. I did a general cancer presentation. Let me just share my screen and then we can begin. Can you guys see my screen?
Yes.
Okay. So my topic today will be understanding cancer and risk reduction in the youth. So, like I said, I work in the International Cancer Institute. So just a brief about it before we go to the main topic of the day. So International Cancer Institute is a not-for-profit leading organization with a proactively evolving approach in cancer, in care, research, training, advocacy, with focus on cancer control in the sub-Saharan Africa. So we officially opened our doors in May 2019 with our goal being to produce quality outcomes while working with a team which is highly qualified in the health sector. And for more information about our work and everything that is pertaining to International Cancer Institute, kindly you can visit the website of intercancer.com. So below is a picture of International Cancer Institute Care and Research Clinic, where we pride ourselves with providing high quality, comprehensive and compassionate and continuous healthcare. We also do training and research and use innovative and IT integrated approach to community that we serve. So that's into the clinic, the services we offer. So we do specialized oncology consultation and treatments. We also do family medicine, patient education, palliative care. We have a specialized oncology pharmacy. We do screenings for screenable cancers and other non-communicable diseases. We also offer patient navigation and coordination. We also offer telemedicine solutions, especially in times like this where we have the pandemic and people can't travel. We offer the IT telehealth solutions. So apologies for that. Let me just reshare my screen. So these are the objectives of this talk for today. So I'm going to do fact sheets on cancer, where we stand. We are going to have the definition, risk factors, signs and symptoms, the continuum of cancer care, risk reduction, and cervical cancer screening, and the vaccination program. So the first fact is in 2018, about 10 million people died from cancer alone, which is a big number, meaning that cancer is one of the leading one of the leading cancer causes of mortality in the world. And this information is from the WHO. And then you find that 1 in every 5 people will develop cancer before the age of 75. And what this tells us is that there's a lot to be done in order to mitigate this by the time that we get to 75, being that the majority of the people right now is the young population. So another fact is that estimates show that by 2040, more than 2/3 of new cancer cases will be in the low and middle income countries. And remember, here is where the survival rates are currently lowest. So what this tells us is there's a lot to be done in cancer care. And we, the youth, we are being called for to step in the gap and be actively involved in the cancer fight. So I will start with the definition of what cancer is. I'm happy that in our midst there's the healthcare professionals who have a better understanding of what cancer is. But just as a definition, cancer is a large group of diseases that can start in almost any organ or tissue of the body where abnormal cells grow uncontrollably, go beyond their usual boundaries to invade adjoining parts of the body and spread to other organs. It is also known as a neoplasm or a malignant tumor. So just to introduce the topic and get the picture, in Kenya, cancer is the third leading cause of death after infectious and cardiovascular diseases. And according to the International Agency for Research in Cancer, the Global Can Report 2018, it estimated about 40,000 new cases of cancer annually, with a mortality of close to 33,000 cases. Well, this represents about 2/3 of the total new cases, and that should worry us. Of note is that is a 45% increase compared to the report done in 2012. So questions should be asked. Why are the numbers rising? What are we doing wrong? What can we improve? What are the reasons for these numbers being high? And what can be done? So again, this data from WHO, the country profile for 2020, cancer country profile 2020. 2019, the census population showed we have about 52 million people. And the estimates of the new cancer cases is 47,000 and total deaths of 32. So on the right side of the screen, I'm just trying to zoom a bit. So the most cancer cases reported in 2018, you can see the breast cancer was leading, followed by cervical cancer. That is in terms of incidence. And then which was closely followed by cancer of the esophagus. However, of note or interesting is that mortality-wise, cancer of the esophagus was leading, followed by cervical cancer, followed by breast cancer. Okay. And this is quite interesting because you can see, like in the case of breast and cervical cancer, breast is much more prevalent. However, in terms of mortality, cervical cancer kills more than the breast cancer. And just below there, you can see population attributable fractions, the risk factors that were found to be contributing to these cancers. And that is tobacco, about 8.8%, alcohol 5.9%, infections at 1.3%, and obesity at 1.1%, and UV light at 22.8%, and other occupational risk at 0.8%. So you see most of our data is indicating that infections play a big role in some of these risk factors and development of cancers. Okay. So I'll go straight to the risk factors, and I've tried to stratify them into 3 categories. There's environmental factors, genetics factors, and other factors that I'll mention later. So on the environmental factors, we find things like lifestyle factors, that is in terms of nutrition, in terms of tobacco use, alcohol, and physical inactivity. And nutrition, we're talking about the unhealthy diets, the highly processed foods, sugars, red meats, and all that. They have been seen to contribute to development of cancers. The other point is naturally occurring exposures, things like ultraviolet light, radon gas, and infectious agents. In terms of infectious agents, we have things like human papillomavirus, we have things like Epstein-Barr virus, we have the HIV virus that have been seen to cause a number of cancers. So another environmental factor are medical treatments, past treatments, things like some chemotherapy agents and radiotherapy that have been shown to cause some secondary cancers after treatment of the first cancer. You can also get secondary cancers. The other point is workplace and household exposures. This in terms of asbestos and industrial chemicals such as benzenes. Others include indoor and outdoor air pollution. In these terms, I mean things like soot and wood dust. Just remember, also includes households that use charcoal or rather firewood for cooking. Something like cancer of the esophagus have been seen to be some correlation between the in-house smoke and the development of cancer of the esophagus. Number 2 is genetics and heredity. So you find some of the cancers are attributable to some genetic changes and mutations of the body, of the DNA, of the body's DNA. And these are such things like breast cancer, ovarian cancer, pancreatic, find even in case of prostate cancer and colorectal cancers, they have some certain heredity predisposition in terms of DNA. And as much as it's not a guarantee that if the gene is passed on to the offspring that one will develop cancer, there's a good increased chance of developing cancers. But again, genetics is a whole big topic, but it has been shown to contribute to a number of cancers. Other factors include things like hormonal factors, chronic inflammation, things like immunosuppression in terms of maybe things like AIDS. And also it has been shown that age, and in this case, increasing age, the more you grow old, the more you're at risk of developing cancer. That is not to, again, to say that you don't have a risk of childhood cancers. So the risk of developing cancer depends on the risk factor you're exposed to and how often one is exposed to. So it doesn't mean that if you're being exposed to these risk factors, it is a guarantee that you develop cancer. So what are the signs and symptoms of cancer? So different cancers have different presentations. And some of the general signs and symptoms include, but not limited to, can have lump or swellings, pain, which is often new onset with steady worsening. You might have persistent fatigue, nausea or vomiting, unexplained weight loss, skin changes, changes in bowel or stool habits, abnormal vaginal bleeding or discharge, and unexplained low-grade fevers, or even recurrent infections. So next, I'm going to talk about the cancer care continuum. And by this, I mean from the point of prevention to the point of end of life care. So, so in cancer, we mainly from the National Cancer Strategic document for preventing cancer, there were 4 pillars, and one was screening and prevention. And so we want to start managing cancer, or rather treating cancer from the prevention. And what does this entail? It entails from the point of vaccination, tobacco smoking policies, in terms of diet, in terms of lifestyle, in terms of physical activity, that will go a long way in preventing some of these cancers. So assuming that, unfortunately, one is feeling that he is predisposed to one of these risk factors, so what next? So that's where if you do prevention, there's a primary prevention, there's secondary prevention. So in terms of the primary, you want to do the screenings also. So in this, you'll have to go to a hospital or to a clinician or a doctor, whereby a clinical exam can be done. You can have several testing, maybe imaging, things like mammogram, things like colonoscopy or endoscopies, and even clinical laboratory investigations. This can be used to screen you for some cancers and even detect a precancerous disease or even disease that is in early stages. And so what happens after you have been detected and there's an early disease or disease has been found, cancer has been found in the body. So that's the point of diagnosis, and clinical assessment has to be done, whereby if, just to go back to the Grace Thuo's point about the biopsies, the liquid biopsies and BMAs. So just to say that the diagnosis of cancer is done through tissue, or rather a specimen that proves that the cell is abnormal and indeed is cancerous. So this can be done in terms of a biopsy. Biopsy is a specimen, or rather a sample of the swelling of the lump or even of the blood that is interrogated for cancerous cells. So you might have all these plus the new technology coming, the liquid biopsies, but at the end of the day, for you to be told you have cancer, you must have a biopsy that gives what we call a histological diagnosis. So once a diagnosis is made, you'll see the doctor and he'll assess you. You will be sent for some imaging, maybe CT scans, MRIs, ultrasounds, to stage you. You'll be told whether are you in stage 1, are you in stage 2, are you in stage 3, are you in stage 4. And all these stages will indicate and dictate the treatment that you receive. So in cancer, we say that we have 3 modalities of treatment. You have systemic therapy, which is chemotherapy. You have other local therapies, things such as surgery, surgical therapy, radiotherapy. And there are newer treatments such as immunotherapies and targeted therapies, and even nuclear medicine therapies that can be applied to some specific cases. So after the treatment, you start what is called survivorship. And survivorship now is like what Grace is now going through. After treatment, she's now cured. So she's doing survivorship, but she's still having the regular clinics that check her status and how she's doing. So in the survivorships and the routine clinics, you might still have some imaging requested of you, maybe every year, once a year, or even 6 monthly, or 3 monthly, or even 2 yearly, depending on how the doctor views your case. So in some cases, unfortunately, the cases are more advanced and terminal. And for these patients, we do what we call end-of-life care. And in this end-of-life care, that's when you find some people being referred to hospice care for comfort during their last days or months of life. So of note is something we call palliative care. So palliative care is a holistic approach to patients in terms of their psychosocial, spiritual, pain, and even nutritional management. So for palliative care, you start it from the point of treatment, at diagnosing the patient starting treatment, all the way to the end. Palliative care has no like a time that you say now that's the end of palliative care. It's a continuous process. So I hope that point is clear, because I wanted to bring out that continuum well so that people can understand how cancer is diagnosed and how it's treated. And then we'll go back to risk reduction and mitigation. But before I go to the risk reduction and mitigation, I wanted to speak briefly about cervical cancer, because we are the young people here. And this is one of the cancers that I feel that we, the youth, can play a big role in preventing and even mitigating it. So, like I said, cervical cancer is caused by a virus called human papilloma, which is virtually responsible for all cervical cancer cases. and additionally other cancers, including anogenital and head and neck cancers. So you can imagine that in 2015, about only 16.4% of women aged between 30 to 49% had been screened for cervical cancer. This is appalling, to be honest, because the services have been there, but the uptake has been poor, and probably we need to find out reasons of why there's that poor uptake of the screening services. So again, in the estimates of 2018, there were about 5,250 new cases of cervical cancer. And in those, about 3,286 died, and which is a great percentage. So, sorry. Okay, the slide that is missing. So anyway, so over that number, so we ask ourselves, which are the preventive factors for cervical cancer that we can apply to our setup? So the HPV, human papillomavirus, is mainly sexually transmitted, okay? And in that, it means lack of condom use, multiple sexual partners. And in terms of prevention, that's why we are advocating for safe sex. That's use of condoms, avoiding multiple sexual partners, and even other cofactors such as tobacco and even HIV infections. This can be applied to prevent cervical cancers. The third is what we call the HPV vaccine, which I believe all of us have seen, maybe for those in Kenya. The government recently launched a national vaccination against HPV campaign. And it's close to free, I think it's 50 bob in the government hospitals, but still there's been a lot of opposition to the program. So the national program recommends vaccination from of young girls from the age of 9 to 25 years. However, even beyond even beyond that age, it can still be given so long as you have done a HPV DNA test that is negative. And this vaccine is given in 2 or 3 divided dosaging. And so far from our data, we haven't had any adverse reactions from this vaccine. Before this, the regular screenings. For the screenings, apologies, there's a slide that is missing, I think. Let me just see whether I can fetch it. Okay, I can't find it. But anyway, so for cervical cancer, the screening, who are targeted for the screening? Any woman who has had sexual contact or is sexually active is eligible for screening. So in Kenya, the target population is women between the age of 25 to 49 years. And that is a screening that is done every 3 years. And every yearly for people living with HIV virus. And additionally, even the elder women between the ages of 50 to 65, they are at risk of cervical cancer, and screening for them is recommended every 5 years. So in Kenya, we use what we call the HPV DNA testing as our primary screening tool, or rather method, for mostly women above 30 years, okay? Other methods of screening include what we call VIA or VLI. VIA is visual inspection with acetic acid. That is quite quick. You get your results within 3 to 5 minutes. And others include pap smears. And those are the 3 main methods that are used. And of note is For women, you don't have to go to a hospital for you to get the pap smear done for you. There are now self-testing pap smear kits that you can buy in your chemist. They have instructions on how you can take your sample or specimen, take it to a lab or a hospital, and get your results. So there's no reason at all that we find or women are afraid of having the test done. So let's take up the screening initiatives the government has offered and the vaccinations. And these have been shown to eradicate cervical cancer up to close to 95% in the Western world. In countries like Australia, they have had a very successful campaign in that country. And the prevalence rates for cervical cancer have been quite low. So next I'll go to risk reductions for cancer. So this data, I got it from an agency called European Code Against Cancer, or the International Agency for Research in Cancer, on the 12 steps of risk reduction on cancer. So one, avoiding smoking or any form of tobacco use. Two was smoke-free homes and workplaces. Number three is taking action to a healthy body weight. Four is physical activity and exercises. Five is healthy dietary habits. Six is limiting and avoiding alcohol consumption. 7 is skincare, avoiding too much sun exposure. 8 is occupational health and safety precautions. And 9 is limiting the exposure to naturally occurring radiation, things such as radon gas. And for women, it is encouraged that you breastfeed your children and limit the use of hormonal contraceptives or even hormone replacement therapies. Remember, one of the risk factors we said that hormonal factors also contribute to breast cancers. And in this case, things like breast cancer and ovarian cancers. Number 11 is vaccinations. Like I said, infections are one of the leading causes, or rather risk factors for cancer. We have things like hepatitis B and C virus that cause liver cancers. We have things like human papillomavirus, like I said, causing cervical cancer. Another infections such as Epstein-Barr virus and HIV that have been seen to contribute to some cancers. Lastly, number 12 is regular cancer screenings as per the national guidelines. So I believe that was my last slide. But I want to end by saying that earlier this week we had, it was one of the most profound and maybe sad weeks because we lost one of, for those who are Marvel fans, one of the actors, and he had been diagnosed with cancer. And he was quite young, at 43. And this just goes to show that no one is immune to cancer, and let's, as the youth, take up the fight, join forces, and we shouldn't feel like we are not part of this fight. Let's all join hands and let's fight this scourge in whichever way that we can. So I'll leave with the final quote from the departed hero, and he says, "In times of crisis, the wise build bridges while the foolish build barriers." So let's build these bridges. Let's make noise and advocate for cancer care. Let's join hands and join programs such as Grace Duos, which advocate for cancer care and treatments for children. Let's also be actively involved in advocacy and screenings. And let's, as a youth, let's believe and trust that our future is now. And that's the end of my presentation. Thank you.
Thank you so much, Daktari, for the powerful presentation. The last the last quotes from the famous Marvel actor really hit the point home. And yeah, I hope all of us have been motivated, or at least you're thinking of trying to take a step or an initiative to at least raise my awareness on cancer, whether it is a childhood cancer or the youth cancer, anything related to health. I hope all of us have been motivated to at least take an initiative and work on it. So quickly to at least, so the first one is, what are the long-term side effects or late side effects that are possible based on the cancer treatment methods that a child receives? Let me repeat that. What are the long-term side effects or the late side effects that are possible based on the cancer treatments that the child receives? Either Grace or Daktari could answer. Maybe I could first approach Daktari.
So thank you for that question. So it will depend on the treatment that the child got and the type of cancer that the child had. So in terms of chemotherapy, it will also depend on the agents used. And we find that some of these chemotherapeutic agents, they have these long-term or delayed side effects. And some of them include things like these children, when they become older, they have trouble maybe getting kids. And another delayed or long-term side effect, you find that these children will, there's a probability or possibility of developing secondary cancers. Those are the main delayed side effects from these treatments. So in terms of chemotherapy and radiotherapy, you can have chances of developing secondary cancers and infertility in some of them. However, this is not to say it is a guarantee that so long as much as a child got this, that he or she will develop that. It is individualized, and this is just a caution and something that can happen.
Okay. One question from the participants was that, are there any cancers that are detected through blood tests? If there are, please could you highlight them?
So there are a number of cancers that can be detected in blood tests. Remember, we have two types of cancers. We have what you call hematological cancers, and we have what we call solid cancers. So for hematological is mainly blood, and then solid is the other organs like the stomach, the liver, and the likes. So for all hematological cancers, they are diagnosed by blood, or what we call, most of them we do what we call bone marrow aspirate or a trephine biopsy that will confirm these cases. This includes things like leukemia, includes things like lymphoma, and other hematological malignancies that occur. But mainly for lymphomas, leukemias, you have to diagnose using a bone marrow aspirate, which is mainly blood from the bone marrow itself.
Okay, thank you for the response. Then
Additionally, sorry. For lymphomas, sometimes you can do it from the bone marrow or even from a lymph node that is swollen. Okay, so mainly leukemias are the ones that are diagnosed via blood and a bone marrow aspirate.
Okay, thank you for that. I'll move to a topic that has been quite controversial in the country, the HPV vaccine. Could you now maybe give us your professional take, or as a doctor? I know you have advocated for it, but maybe just to calm people's nerves, do you trust the vaccine? Because there has been quite a number of cases coming up. It causes sterility, and there are so many side effects. Maybe you could iron out the matter to at least encourage people to take up the initiative.
Well, definitely I'm pro vaccine, and I speak from a scientific point of view, and from the data that I have seen, unless proven otherwise, there are no adverse side effects from this vaccine. The worst I've read is a case of syncope or fainting, and later the child or the girl woke up and she was well. So about this sterility, probably it's something that maybe we can study as we go on, but so far the data that we have from the trials and everything, we don't have anything to suggest very serious or adverse side effects. Some side effects listed or adverse side effects include local side effects like swelling, like pain, low-grade fevers, and you can have anaphylactic reactions, maybe fainting, and then later you gain your conscience. But apart from that, I haven't seen anything that is really worth shouting about.
Okay, and to the last question that I've received, you've talked about hormone replacement pills that might actually trigger the development of cancer. Is it safe to say that the contraceptives that are currently on the market are a high risk for the ladies in developing some certain types of cancer?
So, well, for the contraceptives available in the market, I want to say that there is a good risk of developing some cancers. But remember, like I said, it depends on the exposure, how often, and the frequency of the exposure. So there's someone who is speaking.
Excuse me?
Yes.
Hello.
Hello.
Anthony, I have a question.
Yes, go ahead.
Hello, can you?
We can hear you, but
Hello?
you're breaking up.
Okay, let me, what about now?
Better.
Okay, so talking about, when you're talking about the signs and symptoms of cancer, you talked about change in bowel or stool habit. Could you please expound a little bit about that?
Okay, all right. So I'll go first. The first question about the hormone replacement therapy and the contraceptives. So there's that risk of developing cancer. But remember, like I said, the disclaimer was it depends on the method of exposure and the frequency of exposure. So it's not to say that the contraceptives available, they are wrong or they are not fit for the population. So it's just a caution on unnecessary use and unnecessary use of the hormones. In terms of contraceptives, if you don't need it, don't use it. That's my main point. And you find in Kenya things like the emergency contraceptives, they are quite, they are being used on the rise quite frequently. But again, does not say that it causes cancer. Hormonal factor is just one among many other risk factors. And remember, these risk factors, they're just like trigger points. They initiate a process, and then now you have the mutations and now the promotion, and eventually now development of the cancer. So it's not to say that we shouldn't use the contraceptives. Please, if you're in a position and you qualify for them, please go ahead and use it. So to the second question about change in bowel habits and stool habits, I was talking about this in relevance to colon and rectal cancers. So in this manner, we mean that you find changes in stool in terms of you might have a change in color, in caliber, or even you're finding you're getting constipated frequently, or or even passing chalk-like stools. In some cases, you might have frank blood mixed up with the stool. In some cases, you might have blood that is mixed up with the stool, looking very dark in color. It's not fresh. We have, like I said, chalk-like stools. They are very thin. The constipation, and you will also start feeling pain around the pelvic region, and very unspecific, but persistently still there. So in terms of the changes I was talking about, the color, the caliber, signs of blood in it, and even the frequency of how often do you go, are there any changes? It will probably indicate something, but mostly importantly, the caliber and the color and blood in it. Yeah, I hope I've answered your question, Vincent.
Yes, you have. Thank you very much.
Okay, if there's any other question, please ask. I don't think so far there's any other question. So probably you could add another vote, leave parting shot that we could finalize with.
Hello.
Doctor. Oh, sorry, Dennis. Yes, go ahead.
I'm sorry. I actually have a question. My hand is up.
Oh, okay.
So I wanted to ask Dr. He talked about risk factors that are putting us into, as in falling victims of cancer, but I don't understand how age is. I would want him to explain further, because I believe being older or being young, you are just vulnerable to being a cancer victim. So maybe he could share more details about it, about the age. Thank you.
All right, thank you, Dennis, for that question. So in terms of age, this is not considering the childhood cancers. I'm talking about the adult cancers. And you find cancer is depending on the type, most of the cancers, they are a process that develops for some even up to close to 20 years. So some people even die, and you'll only be noted to have cancer after the postmortems. So in the manner I speak is that age factor is the time that the cancer cell is given to mutate and develop and become malignant. So case in point, something like prostate cancer, you find that naturally for us men, when you attain the age of around 50, definitely or inevitably your prostate starts developing some changes, what you call a benign prostate hyperplasia or BPH. But now, because of some of the risk factors that I mentioned, you might find they will trigger or give signals to your DNA and start causing your prostate to start growing uncontrollably and becoming malignant. So in the manner that it started maybe when you are in your 40s and the prostate is discovered when you're in your 60s or even 70s, that in itself is a risk factor. Another case in point, things like colorectal cancers, they mainly occur in the ages of around 55 to 60 or 50 to 60 years with a median of 55. And for these patients, it's something that develops as a polyp. And then with time and over time and years, it starts becoming malignant. So in terms of age, I'm just speaking in terms of the time that a cell is allowed to transform from a normal cell or a benign cell to now a malignant cell. So not to make you scared about the age thing, it is just one of the less contributing factors. That's why I put it as others. So let's not fear the age factor.
Okay, thank you.
Okay.
Any other question?
There's a question from Vincent on the chat box. He's asking, does anal intercourse predispose one to anal CA? Remember, like I said, there's a virus called human papillomavirus, and it's sexually transmitted. Human papillomavirus is responsible for chiefly cervical cancer, penile cancer or penis cancer, vulval cancer, vaginal cancers, some throat cancers, and what else? Generally anogenital and head and neck cancers. And anal is not spared. If the partner has HPV and one contracts it and the HPV is not treated, then with time, maybe with other cofactors in there, there's a very good likelihood that the person will develop anal cancer. So yes, it will be predisposed one.
Okay, just to answer a question that came to me directly, for those who are interested in joining Grace in Malaika Shujaa initiative, you could, after this session, you could contact Yoba, the Miss Katile Raha, then she'll link you up with Grace so that you could join the team. And in case there'll be any activity that will be organized soon, she will keep you on the loop. So I think Ms. Raha will provide the appropriate contacts to get to that. But if you can reach her directly, she will gladly guide you. Is there anyone else with a question? Jackson Kigozi just asked a question. The myth about uncircumcised penis carrying HPV. I'm not sure. I don't know if, he needs some enlightenment around that. Dr. Muchiri. Hello, Dr. Muchiri. There's a question for you. There's someone asking about uncircumcised penises carrying the HPV virus. Is it true? Or is it a myth?
I was speaking when I was muted. Apologies. So about uncircumcised men, it is true that a high risk of getting HPV. Reason being that with the foreskin on, you have a harbor for most of these infections, which are mainly sexually transmitted, in the manner that often the area is not cleaned as much as probably for someone who is uncircumcised. So in the manner that the same foreskin predisposes one to more risk of HIV, is the same manner that he's more at risk of getting the HPV infection. And in fact, in one of the literatures about cervical cancer and HPV prevention, it is advocated that the sexual partners be circumcised. However, we have to know that these are, in the African setting, we have all these cultural and traditional beliefs that intertwine with medicine. So it is very prudent that we know how to navigate it with the wisdom that will not offend one community or the other. But to the answer of that question, the answer is yes.
Okay. Any other question? Thank you so much for the answer. Any other question? I think I'll welcome Ms. Raha to finalize and give a closing statement as she gives the directions on how you could join Malaika Shujaa.
Good evening. I'm Katile Mutuku. And on the direction to join Malaika Shujaa, I think Grace can give us the information if she's still in the group. Or Ruth Mochama. Madam Ruth.
Hi.
Hi.
Can you hear me?
Hello, is anyone speaking? I would wish to answer one question in the chat box from Youth Barriers Breakers Africa, I think the host there. He's asking, or rather the point is there has been a case of rise in throat cancer related deaths. Why the case? I think Humphrey or something. So to answer this question, we still don't have answers yet in the manner that the studies are still ongoing. However, there are few factors which have been linked or said to be contributing to this. Because if you look at the trend, it's mainly in the belt, in the northern belt, and then the south rift in some areas of Tanzania, Malawi, even down south. And some of the risk factors that have been posed are that increased tobacco smoking and taking the thermal temperatures of some of these beverages that we take. Like there's a study going on about the thermal temperatures of things like tea, water. Can they cause damage to the throat, causing the chronic inflammation I talked as a risk factor. Additionally, other factors that compound include things like the HPV co-infections that cause the immunity to be low and then develop the throat cancers. Other factors include things like spicy foods that some elements sort of irritate the throat, causing a development of chronic inflammation and thereafter throat cancer cases. So studies are still ongoing. I know of many studies being done about the throat cancer rises, and probably in the same forum, I'll share about the results with you guys. Hi, Michele.
Yes, yes.
Kindly take over and maybe wind up the session if you're done.
Okay. Is it possible if you could leave your email in case there's any other question that someone might have for you?
Okay, I'll send my email. I'll also send you the presentation.
Okay.
Let me just type the email on the chat box.
Chat box, yeah.
Okay.
Okay. For those, I think Ruth had a problem with her internet, so she might not be able to give the directions. But in case you're interested, the email you received for the Zoom meeting, you could ask.
I can hear you now.
Oh, okay, yeah. Please give guidance on how to join.
How to join Malaika?
Yes.
Okay, so basically what we normally do is organize forums, visit children homes, mostly those who have children with cancer and those without also. We also do a lot of advocacy by creating various campaigns. So if you want to be part of Malaika Shujaa, you can reach us via email or you can DM us on any of our social media platforms. So where our handle is at Malaika Shujaa, that is on Twitter, Instagram, and Facebook as well. Alternatively, you can email us on mshujaa7@gmail.com.
mshujaa7@gmail.com.
Yeah, 7 is the number.
Okay. I've typed it in the chat box. Anyone interested?
Okay.
Cool. Okay. Thank you so much for that. This has been a wonderful session. Thank you everyone for attending it, and I hope you'll be available for tomorrow, day 4. And I hope you've carried quite a lot of information from this. Thank you so much, Youth Barrier Breakers Africa, and all the other parties that are involved in making sure this whole process or this whole week has been arranged. Thank you, Daktari, for coming, and thank you for the information. In absentia, we'd like to thank Grace for her story, and empowering us on her initiative. For those who would like the recordings, we will email it to you, and also we will soon update it in our YouTube channel, the Yoba YouTube channel. So yeah, keep an eye out there for it. And I hope everything has been insightful for you. Thank you, and you're free to leave at will. Have a lovely evening.
Okay.